Welcome friends, I am Dr. V.K. Chauhan, homeopathic physician. Revise with me homeopathic remedy Borax Veneta. This is part 2, general overview in a classical format. The text is being taken up from Allen's keynote, and this is a good study for BHMS students and interns. So we go to the first general information part, which is not given in Allen's keynote. So remedy profile, it is a small remedy having predominance of GIT symptoms. It belongs to the kingdom, mineral kingdom, and the formula is Na2B4O7 10H2O. Source, it is a chemical compound of sodium available with chemist. Preparation. Triturations are prepared with sugar of milk, and the remedy was proved by Dr. Hahnemann. Organ tissue affinity or sphere of action includes nutrition, mind, mucous membrane, especially mouth, and the skin, kidney, and bladder. Let us go to the review from Allen's keynote. The constitution. The physical component or somatic component includes young woman of shining red nose, children, especially during dentition. Side affinity is right-sided remedy. Thermal affinity, it is a ambithermal remedy. Psychic component, we find temperamentally the Borax client is nervous, anxious, and fearful. Mentally, we find dread of downward motion in nearly all complaints. Great anxiety from downward motion. When lying the child down to a couch or in the crib, cries and clings to the nurse. When rocking, dancing, swinging, going downstairs or rapidly downhill, horseback riding, it is similar to sanicula. Children awake suddenly, screaming and grasping side of cradle without apparent cause. Similar symptoms are found in apis, cinna, and stramonium. Mentally, we again find that the Borax client is excessively nervous, easily frightened by the slightest noise or an unusual sharp sound. A cough, sneeze, a cry, lighting a match, etc. Similar symptoms are encountered in Asaram and Caladium. Dreams, we have frightful dreams and desire for water is there. Now we go to the causation, and in the diathesis part we find the client has nervous, anxious, phobic affections along with GIT and skin complaints. Ailments from smoking, which may bring on diarrhea. Apathy from dentures. Characteristics we find in the head region, hair becomes frowsy and tangled, split, stick together at the tip. If these bunches are cut off, they form again, cannot be combined. Similar symptom is present in fluoric acid, lycopodium, sorinum, and tuberculinum. In the face, we find eyelashes loaded with dry, gummy exudation, agglutinated in the morning, turn inward and inflame the eye, especially at the outer canthus, tendency to wild hairs. In the nose, we find nostrils crusty, inflamed, tip of the nose shining red, red nose of young woman. stoppage of right nostril or first right then left with constant blowing of nose. Similar symptom can be encountered in ammonium carb, lac and magnesium mure. In the mouth section, apathy in the mouth, on the tongue, inside of the cheek, easily bleeding when eating or touched, prevents child from nursing with hot mouth, dryness and thirst. Similar we find in arsenic, cracked and bleeding tongue as we find in asarum, aurum, salivation especially during dentition. Mouth section, again we have aphthous sore mouth, which is worse from touch, eating salty or sour food of old people, often from plate of teeth, alumen. Urinary complaints, we find child has frequent urination and screams before urine passes. Similar symptoms are present in Lycopodium, Sanicula and Sarsaparilla. In females, we find leukorrhea, profuse, albuminous, starchy, with sensation as if warm water were flowing down for 2 weeks between the catamania, and here we have comparison with bovista and conium. In the skin section, skin is unhealthy, slight injuries suppurate. We see similar symptoms in calendula, hypersulph, murk and silicea. The relationship borax follows calcarea, soranum, sanicula and sulfur. It is followed by arsenic, bryonia, lyco, phosphorus and silicea. Incompatible. Should not be used before or after acetic acid, vinegar and wine. The general modalities include aggravation, downward motion from sudden, slight noises, smoking, which may bring on diarrhea, damp, cold weather, and before urination. Amelioration is by pressure, holding painful side with hand. The miasmatic orientation, let us go to miasmatic markers, and these are nervous anxious, traits point to soric miasmatic component. Gummy exudation points to psychotic trait. Apathy recurrent points to syphilitic trait. So our impression on above is that borax is a sorosyphilitic mixed miasmatic remedy. Posology. Doses 3x to 200 potency, locally useful as an application in pruritus in the form of lotion. Repetition bears repetition well in skin affections. Duration of action, we find it acts for 7 to 8 weeks. The clinical condition where it is suitable are fear of falling, basophobia or basiphobia, separation anxiety disorder, apathy, gastric ulcer or cancer, dysuria in children, nightmares, easy suppuration especially folliculitis, and leukorrhea, which is albuminous. So friends, thank you very much for patient listening.